Good day. Greetings and welcome to today's childbirth class, wherein we will be tackling information and as well as expectations about the childbirth process. So, first off, I would like to introduce our team, also the topics that we will be discussing. Our team is comprised of student nurses from the UST College of Nursing. The first topic, which is all about true labor and false labor, will be discussed by yours truly. The second topic covers the stages of labor and will be presented by student nurse Dana. Third topic would be management of labor pain, covered by student nurse Keith. Next topic are the events during labor and delivery and will be presented by student nurse Millevon. And lastly, we have the EINC protocol covered by student nurse Chrystan. So, to begin, we have true labor versus false labor. So it is very common for pregnant women to think that they are experiencing the real thing, only to go to the hospital or call their midwife and be told that it was a false alarm or false labor. So you may be asking yourself, what is false labor? How will I know if I'm experiencing false labor? So meron pong ibang mga pregnant mothers na akala po nila nag-labor na sila. So there is a term called the Braxton-Hicks contractions. These are contractions or paghihilab, however, are irregular in pattern and are not that painful as compared to true labor contractions. So bakit po may Braxton-Hicks contractions? This is to prepare the mother for true labor. So meron po tayong criteria in determining false labor from true labor. First, we have false labor. So firstly, we have irregular and unpredictable patterns of contractions. So for example, contraction intervals of 10 minutes, then 6 minutes, 2 minutes, then 8 minutes, and so on. So there is a varied interval of contractions, which is a manifestation of false labor. Next would be no progression is seen over time, and this is related with concentrated contractions. So contractions are felt as a generalized abdominal tightening, localizing in the lower abdomen and groin. So kung ang sakit po ay hindi kumakalat sa likod o di ho kaya sa ibang parte ng tiyan at nananatili lamang po sa isang parte ng tiyan o bandang ari, ito po ay masasabing false labor. Next, we have changes in activity or position causes contractions to slow down or stop. So an example of this would be having the mother to walk, and if contractions stop or slow down upon walking, then this is considered false labor. Next would be there is usually no bloody show, which manifests as false labor. And lastly, membranes will not rupture. So membranes, particularly the amniotic sac o mas kilala po natin na panubigan ay pumutok. Kung hindi po pumutok ang panubigan natin, ngunit may paghihilab, ay ito po ay masasabing false labor. Next naman po, we have true labor. So for true labor, we have regular pain, which is usually evident through the duration of contractions. An example of this would be contraction durations of 20 to 40 seconds with now non-varying intervals o napapadalas na po na paghihilab. Next would be radiating pain. So pain tends to begin high in the abdomen, radiating throughout the entire abdomen and lower back or vice versa. So kung ang sakit po ay kumakalat hanggang sa ating likod o di ho kaya sa iba pang parte ng ating tiyan o puson o bandang ari, ito po ay masasabing true labor. And lastly, changes in activity or position do not cause contractions to slow down or stop. So kung si mami po ay nakakaranas ng sakit o hilab, at pag si mami ay ating pinalakad at hindi nawala o nabawasan ng paghihilab, masasabi po natin na true labor po ito. Bale, ito ho ang pinagkaiba ng false labor sa true labor. And for the next topic, I would like to set the stage for student nurse Dana.
So now that we know the difference of true labor from false labor, let's now discuss about the different stages of labor o ang mga maaring maranasan ng mga nanay sa oras ng panganganak. So ito po ay nahahati sa tatlong parte. The first stage or the dilatation stage, the second stage or the expulsion stage, and the third stage or also called the placental stage. So isa-isahin po natin sila. Ang first stage of labor po ay nagsisimula once na nagka-true labor na po si mommy, hanggang sa tinatawag nating full dilatation of the cervix. Ang cervix po ay ang lower portion ng uterus o sa Filipino po, matres po ni mommy. Ito rin po nagsisilbing opening po sa vagina kung saan dadaan po si baby palabas kay mommy. At dahil ang first stage po ng labor ay tinatawag ding dilatation stage, ang ibig sabihin po nito ay numinipis at lumalaki po ang cervix in preparation for the delivery of the baby. The first stage po ng labor is also the longest stage, lalo na po pag first time mommies po. Maaaring ito po ay tumagal ng 13 to 18 hours, and this is further broken down into three sub-stages: the latent or early phase, the active phase, and the transition phase po. So first, the latent phase or the early phase, during this phase po ng labor, hindi pa po masyadong kinakabahan po si mommy. In fact, napaka-excited po niyang manganak. Dito rin po kasi nangyayari ang mga mild and short uterine contractions po, meaning tolerable pa po ang mga hilab na mararanasan po nila. Ito po ay nangyayari dahil nga po nagsisimulang numipis at lumaki po ang cervix up to 3 centimeters. And usually po hindi pa po kayo pwedeng mai-admit sa ospital dahil kailangan pong maging 4 centimeters po ang laki. Pero in some cases po kapag nag-rupture na po ang bag of water ni mommy, or pumutok na po ang kanyang panubigan, kailangan na po niyang mai-admit sa ospital. Ang mga hilab din po ay pwedeng maranasan ng mga mommy ng ilang segundo lamang, mga 20 to 40 seconds lang. And ito po ay irregular, meaning maaring 5 to 30 minutes po siya pwedeng mangyari, every 5 to 30 minutes po. So, sa kabuuan, ang latent phase po ay maaaring tumagal ng 8 to 10 hours po para sa mga first time mommies, o di kaya mga 5 hours lamang po sa mga nanganak na po dati. Now we go to the active phase. So during the active phase naman po, nagiging alert na po si mommy at mas demanding na po siya dahil siya po ay excited pero may unting kaba na po. Nagiging regular at moderate to strong din po ang mga hila po niya na maaring tumagal ng 40 to 60 seconds each po. At mas lalo pang lumalaki po yung cervix po ni mommy. Lalaki po siya mga 4 to 7 centimeters. And ito po ay maaari tumagal, yung face po nito, pwede po siyang tumagal ng 3 to 6 hours po for first pregnancies and about 4 hours po for subsequent pregnancies. The last phase in the first stage of labor ay tinatawag pong transition phase, kung saan nagfo-fully dilate na po ang cervix, meaning nagiging 8 to 10 centimeters po ang laki na po ng cervix po ni mommy. This is also a sign na malapit na pong manganak si mommy. Sa phase po na ito, mas lalo po siyang nagiging irritable dahil sobrang focused po niya sa panganganak. At ang mga hilab po niya ay regular na po at strong to very strong na po dito. At ang phase po nito ay nagtatagal ng 2 hours po for first time mommies and mga 1 hour lamang to sa mga nagkaanak po dati. And every hilab po, pwede po siyang tumagal lamang ng 60 to 90 seconds lamang po. Now we go to the second stage of labor, also called the expulsion stage po. So dahil dito po ang panganganak mismo po ni mommy kay baby. This starts po immediately after the cervix of the mother has reached 10 centimeters o tinatawag po naming full dilatation po. And ends po pagkalabas na po ni baby. Dito rin po makakaranas si mommy ng uncontrollable urge to push po o di kaya parang natatae daw po siya. With the help of healthcare professionals, kada ire po ni mommy, nalalabas na po niya yung ulo ni baby o yung tinatawag po nating crowning. There are also essential factors that affect the process of labor and delivery, and this is the 5 P's: passenger, passageway, power, position, and psychologic response po. So let's briefly discuss them one by one. Passenger po refers po kay baby, and dahil po malambot po yung head nila, kaya po nilang dumaan pa po kay mommy. Second P is passageway. Passageway naman po ang daanan ni baby. So, o sa English po, the birth canal. And the mother's pelvic size is also considered po here kasi nga po pag masyado po maliit, baka mahirapan po tayong ilabas po si baby. So next po, the third P is power. Power naman po refers to the contractions of ni mommy, um, and ito po yung pag-iri po niya. So, power refers to contractions or yung pag-iri po. So, that's also important. The next P is position. Yung position din po kasi ni mommy ay important dahil mas lalo po siya mahihirapan mga anak kapag hindi po siya comfortable sa position po niya. And lastly, psychologic response refers po dun sa social support ng healthcare team o di kaya po ng kanyang family po. Importante po ito kasi para po hindi po masyadong kabahan si mommy at mas mapapadali po ang kanyang panganganak. And all in all, the second stage of labor may last from 20 minutes po to 2 hours. And now let's go to the last stage. The third and the last stage po ng labor is also called the placental stage because it is the stage wherein the placenta is delivered po. Ang placenta naman po ay isang temporary organ during pregnancy. This transfers and provides oxygen and nutrients po from the mother to the baby through the umbilical cord po. And ito rin po ang responsible sa pagtatanggal ng mga waste products po ni baby habang nasa loob pa po siya ni mommy. And additionally, the mother may feel small contractions po, pero dito po sa stage na to, it's not gonna be painful po as compared to the other stages po. Hindi na po siya masakit. And out of the 3 stages po ng labor, ito po ang pinakamaiksi, lasting about 5 to 30 minutes po lamang. Ang labor po ay 3 stages po lamang, pero may iban po na kino-consider po nila ang immediate postpartum o ang mga oras pagkatapos manganak as the 4th stage of labor po. So ang unang 4 na oras po pagkatapos manganak ni mommy ay napaka-critical po. She has to be monitored po by the nurses and the doctors to ensure that there's no complications at wala pong problema. Dito rin po nagsisimulang mag-adapt po si mommy sa blood loss po niya, and bumabalik po yung uterus sa dati niyang anyo, yung matres po bumabalik po sa dati. And we call this process as the uterine involution. So now that we know the stages of labor, the question now is, how do we manage it? So I now give the floor to Keith.
For our next topic, we are going to talk about managing labor pains. But before anything else, please remember this. Pain during labor is different for every woman. It varies widely from woman to woman and even from pregnancy to pregnancy. Para sa ibang babae, kagaya lamang ng mild menstrual pain ang pwede nilang maranasan habang nagle-labor sila. Ngunit madalas, maaari silang makaramdam ng sobrang pananakit ng tiyan o puson. Now, what causes labor pain? Ano ba ang sanhi ng labor pain? Bakit ba nararanasan ito ng mga buntis, lalo na yung mga malapit ng mga anak? The main cause of pain during labor is caused by contractions of the muscles of the uterus and by pressure on the cervix. Nangyayari po ang uterine contraction upang mailabas ng maayos si baby. Madalas, ang mga nagle-labor ay nakakaramdam din po ng pressure sa cervix na nagiging dahilan ng pagsakit ng puson o tiyan. Ito po ay dahil unti-unti nang bumababa yung baby. This pain can be felt as strong cramping in the abdomen, groin, and back, as well as an achy feeling. Some women experience pain in their sides or thighs as well. The other possible cause of pain during labor include pressure on the bladder and bowels by the baby's head and the stretching of the birth canal and vagina. Ina-accommodate po kasi ng birth canal at ng vagina yung size ng ulo ng baby. Kaya nagsistretch po ito. At yun po yung isa sa nagiging sanhi kung bakit nakakaranas po ng pain yung mga babae habang nagle-labor. Minsan po, hindi naman yung pain ng kada contraction yung nagpapahirap sa pag-labor. Ang contractions po kasi ay hindi lang one-time thing. As your labor progresses, there is less and less time between contractions to relax. At iyon po yung nagpapahirap sa labor. Pero hindi naman po namin kayo hahayaan na maghirap at tiisin yung labor pain na pwede nyong maranasan. I will discuss some ways on how to relieve labor pain later on. But for now, let's talk about the effects or what affects labor pain. So, the first one is characteristics of contraction, which includes strength, rhythm, frequency, and duration. I won't go into details since this was already discussed earlier, but the general idea that I want to share with you is that these factors, such as kung gaano katagal yung contraction or kung gaano kadalas yung contraction, will contribute to the pain you will feel during labor. The main factor that greatly affects labor pain is your pain threshold. Kung medyo mababa po yung pain tolerance ninyo, kakailanganin niyo po ng extra help and support during labor para po hindi kayo masyadong mahirapan. But if you can tolerate great pain, labor and delivery could be less challenging for you. Another thing that may affect labor pain is having social support or the lack of it. Para po sa mga tatay or sa mga pamilya na may buntis na asawa o kamag-anak, makabubuti po para sa mga asawa ninyo at o kamag-anak yung buntis kung maipaparamdam niyo po sa kanila na hindi sila nag-iisa sa kanilang pagbubuntis. If na-feel po nila na secured po sila, well-supported and well-loved, makakatulong po yan para ma-lessen po yung pain na maaari nilang maramdaman during labor or yung fear and anxiety during labor. So lastly, gaya po ng sabi ko, fear and anxiety can also affect labor pain. So mommies, if you can, and you should, please try to have a positive mindset po. Of course, you cannot fully avoid fearing or worrying about your approaching labor and delivery. But we believe po that you can mentally, emotionally, physically, and even spiritually train your mind and your body to be prepared for that day. That way, you can make your labor and delivery less traumatizing. Like what I've said before, I'll discuss and share with you some ways that you can do to manage labor pain. But why is it important for you to know this? It is important for you to know that the different pain control options so that you will be able to find and decide what pain management works best for you. Pwede po kayong magtanong sa doktor na nagmo-monitor ng pagbubuntis ninyo or kung wala naman po, pwede nyo pong konsultahin yung mga nurses and doctors po sa mga health centers or sa mga lying-in po para po magka-idea kayo sa kung ano po yung pwedeng available na pain relief options na pwede po nilang ibigay sa inyo. Pati po para malaman nyo rin kung gaano po ba ka-effective yung mga yon at kung kailan po yan dapat ibigay sa inyo. If you want to use pain control methods other than medicines po, pwede naman po and meron pong ganun. Actually, we are promoting that po. Pero make sure that your healthcare provider and the hospital staff know about it. You might want to also consider writing a birth plan that makes your preferences clear po. So, these are the things that you can do to ease labor pain. Magsisimula po tayo sa kung paano nyo po pwedeng i-prepare yung sarili nyo sa nalalapit nyong panganganak. First is, get educated, but don't freak yourself out. Knowledge is key for making informed decisions during pregnancy and childbirth, but sometimes, too much information can do more harm than good. I'm sure that most of you po, when you learn that you're pregnant, Nagbasa po kayo ng mga pregnancy books, nag-search po kayo sa internet, or nagtanong-tanong po kayo sa mga kakilala ninyo na naka-experience na magbuntis at manganak. Wala naman pong masama doon, pero lahat po ng sobra ay nakakasama, di po ba? Kaya maging mapanuri din po tayo sa mga nababasa natin sa internet o sa mga naririnig natin sa iba at alamin po natin kung ano po ba yung tama at totoo sa mga yun. At syempre po, mas nakakabuti po kung magtatanong po kayo sa doktor nyo po mismo. In that way, mas magiging personalized po yung info na pwede nyong malaman, depending po on your case and on your pregnancy. Next po is choose your care team and birth setting carefully. Birth is a transformative experience and it can be messy and complicated and emotional. So we want to prevent that. Ensuring that you're surrounded by people you trust and are somewhere you feel comfortable is important to having the best possible outcomes. Of course, when you're comfortable po, nasa comfortable po kayong environment, kilala niyo po yung mga taong surround po sa inyo. For example, you know the doctor who's handling you, mas nagiging positive po yung experience nyo sa pagle-labor and sa panganganak. Third, you should take care of yourself. Ensure that you are getting regular and reasonable exercise. Yes po, pwede po kayong mag-exercise kahit nabuntis po kayo. But you have to remember two things. One, dapat po magpa-consult kayo sa doktor nyo sa kung anong pwedeng exercises yung pwede nyong gawin. And then second, do not overdo it. Kahit po light exercises lang, okay na. Hindi naman po kailangan na vigorous activities po yung gagawin ninyo. Regular and reasonable exercise can help strengthen your muscles and prepare your body for the stress of labor. It can also increase your endurance, which will come in handy if you have a long labor po. Talk to your doctor about what he or she considers to be a safe exercise plan for you. Pero if hindi po talaga kaya na mag-exercise, kahit yung simpleng paglalakad po ay sobrang makakatulong na po sa labor and delivery nyo. Lastly, make a basic flexible birth plan. Mapping out how you'd like your labor and delivery to go can help you feel more confident going in. But when it comes to birth plans, you're better off keeping it simple and going in with the expectations that things may not go the way you envision it or the way you plan it. Minsan po talaga, nagbabago po siya habang nandun po kayo sa procedure na yun. You may include things like the type of support you want during labor. Gusto niyo po ba yung minamasahe kayo during labor or yung ini-encourage kayo with words? You can also include whether you'd like to be able to move around and try different positions kung saan po kayo komportable. And you can also indicate there what pain relief option you prefer. Mga things like that po. Planning and preparing for things like that can reduce the stress and pain that you may experience during labor po. And of course, mas nalilesen po yung kailangan yung intindihin habang nagle-labor po kayo. Now, ito po yung mga paraan para po mais yung labor pain habang nagle-labor na po kayo. So, we have pain medicines and relaxation techniques. Yung mga ibang moms po, gumagamit po sila ng combination ng dalawa. So, these are some pain medicines that may be given to you. One is analgesics. Analgesics can ease pain, but remember that it doesn't numb it completely. Na-reduce lang po yung pain, pero nandun pa din po. They don't affect sensation or muscle movement, so makakagalaw pa rin naman po kayo. However, these medicines can cause side effects including drowsiness or yung pagkahilo in Tagalog and nausea po or yung pakiramdam po ng nasusuka. Moreover po, some analgesics can have effects on your baby, so ask po which is safe for you and your baby. Next po is regional anesthesia. What it does is it blocks the feeling from specific regions of your body, so you won't feel anything on those areas. And then we have local anesthesia like epidurals that relieve most of the pain from the entire body below the belly button. So, below the pusod po, wala po kayong mararamdamang pain, including the vaginal walls during labor and delivery. An epidural involves medicine given by anesthesiologists through a thin tube-like catheter that's inserted in the woman's lower back. And the amount of medicine na pwede po ang i-administer sa inyo can be increased or decreased according po sa pangangailangan ninyo. Ito po yung isa sa pinaka-common na pain relief dito sa Pilipinas, but it has some drawbacks po. It can cause a woman's blood pressure to drop and it can make peeing difficult for them. It can also cause itching, nausea, and headaches to the mother po. Very minimal naman po yung effects sa baby. And moving on po, the following are ways to help you cope with labor pain without medication. And ito po yung pinopromote po natin. Ang maganda po kasi dito is that guaranteed po yung safety nyo and ni baby since wala pong known side effects ang mga ito. So first is massage. Yung pagmamasahe po kasi can relieve muscle tension as well as reduce stress po. Then we have breathing exercises. Deep, slow breaths can help you focus and relax more, release stress, and reduce muscle tension that can aggravate labor pain. Through deep breathing po, you will be able to give more oxygen for your baby as well. Next is visualization. You may find it helpful to picture yourself somewhere enjoyable, such as imagining yourself on a beach or walking through a forest or just imagining anything that makes you feel happy and positive po. For example, your dog, your family, your favorite food, anything that generally makes you at ease could be a great help po when managing labor pain. You can also try music therapy. Make a playlist of songs that make you feel good and play during labor. So, pwede naman po kayong magdala ng phone. Music can help distract you from the pain or help you with your breathing. Pwede po siyang mag-act as a guide po para mag-breathe kayo ng maayos. And lastly, prayer and meditation. Some women get strength in praying during labor po and others naman po do meditation during labor. So, meditation po is combining deep breathing with meditation can help to relax your mind during childbirth, improve your labor experience, and even reduce your perceptions po of pain and length of labor. So, this is a guide po on how you can practice your breathing exercise, breathing techniques during the first stage of labor. So first, start with a slow, deep breath as your contraction starts and then slowly breathe out, releasing all physical tension from your head to your toes. Pag may masakit po kasi, especially when you're having contractions, you may feel na tense po yung abdomen, even your legs po can sometimes be tense too. So, try to practice deep breathing po. And then inhale slowly through your nose so that your stomach presses against your hand. Keep the hand on your chest as still as possible. Engage your abdominal muscles as you exhale through pursed lips. Like this po. When you inhale through your nose and then exhale through your mouth. Keeping the hand on your upper chest still, continue breathing like this po for the duration of your breathing exercise. Each time you exhale, focus on relaxing a different body part. For example, yung first time nyo pong mag-inhale, exhale, nirelax nyo po yung likod nyo. And then the next one naman po is yung thighs nyo. Try to relax different body parts po when you do breathing exercises. Now, these are the breathing techniques naman po done to relieve the labor pain during stage 2 of labor. So, ito na po yung nagde-deliver na po kayo ng baby nyo. So, let the contraction guide you. Breathe slowly, but accelerate or lighten your breathing to maximize your comfort. When you cannot resist the urge to push, huminga po ng malalim. Tuck your chin to your chest and curl your body and lean forward, then bear down while slowly releasing air by grunting or alternatively, you can hold your breath po. Pag may nararamdaman po kayong contraction, hinga pong malalim and pigil and then slowly po nyong i-exhale. It is important that while bearing down, you relax the pelvic floor to help the baby calm down. The urge to push comes and goes in waves during the contraction. After 5 to 6 seconds po, release your breath. Di ba po, sa start ng contraction, huminga po kayo ng malalim, and then tigil. And then, pwede po kayong mag-grunt bago nyo po i-release. Or i-hold nyo po yung breath nyo. Tapos, when you feel the urge again, bear down once more. And then, continue in this way until the contraction ends po. Use the breaks in between pushing to breathe deeply in order to provide oxygen to both your baby and your body. And that's it po. That's how you can manage labor pain.
A wonderful day to all of you. Ako po si Student Nurse Millevon, and I will be discussing what happens during labor and delivery. So I will be dividing this into 5 parts, namely the birth location, things to bring, accommodations, delivery room setup, and the important events. So explain ko po sa inyo what will be expected inside the delivery room and how the healthcare workers will assist you throughout your whole labor, delivery of the baby, and up to postpartum period. So for birth location, we have the hospital, lying-in clinic, and especially your homes. So maganda pong pinag-uusapan niyo po ng partner ninyo kung saan niyo po gusto maanak. So first of all po is in the hospital. Many women prefer and are encouraged to deliver their babies inside the hospital because it's the safest option, especially po if you're at high risk. It's the safest childbirth environment for you and your baby. Kasi po, if magkakaroon man po ng complications during labor, such as prolapsed cord or placenta abruption, for example, there is already an operating room. If you need a cesarean section, it's the only place that you can have one. So, kunwari po, nagkaroon ng complications sa delivery, mayroon po ang sariling operating room ang DR to assist in your operations. It also offers the most advanced technology. There are on-staff pediatricians and anesthesiologists which are always available to provide pain relief medications as you request, from epidurals to narcotics, so for you to have an access to pain relief. Second naman po is lying-in clinic. So these lying-in centers are freestanding facilities na nagbibigay po ng homey feeling sa mga buntis na nagnanais ng natural childbirth experience. Hindi nga lang po ito katulad ng hospital na accessible po sa iba't ibang medical equipments at limitadong tao lang po ang makikita niyo dito. So mas nagkakaroon po kayo ng privacy through your pregnancy. So dito rin po, normal vaginal delivery lang po yung pwede at advisable because yun nga po, wala po silang masyado medical equipments to facilitate cesarean sections and medical interventions when emergency arises. And then kung magkaroon po ng complications, kinakailangan pa po kayo i-transfer sa hospital. Third naman po is home birth. So dito po yung you desire to give birth without medical interventions. Pero makakapag-deliver naman po kayo in a comfortable, familiar place which is surrounded by your family. So this helps you to have freedom and control in birthing process. And some of you might consider home birth for cultural or religious concerns. And syempre, mas mura po siya compared to the hospital settings. So things to bring to your labor and delivery. For mothers, we have comfortable clothes and towel. Syempre po yung loose and comfortable po sa inyo to wear during your stay there. Doesn't restrict you from moving around or to make you feel hot. Usually po, you may need about 3 changes of clothes and magdala na po tayo ng front opening or loose-fitting nighties or tops or nightgowns para po ma-facilitate yung breastfeeding ni baby. Syempre po, going home clothes, socks and slippers, underwear, 2 or 3 comfortable and supportive maternity bras for breastfeeding. Kasi po, yung breast ninyo lumalaki compared to the usual when breastfeeding the baby. So we also have nursing pillow, maternity panties, maternity pads, toiletries, and important documents. Pwede din po kayo magdala ng mga bagay to help you pass time and relax. For example is books or magazines, and birth plan. So, ang birth plan po is to know your preferences in and during your pregnancy. Dala din po kayo ng PhilHealth card, marriage contract if available. So, for your baby naman po, dala po tayo ng going home clothes ni baby. Lampin, infant cap, receiving blanket, changing mat, baby socks and mittens, cleaning products for baby, yun po yung mga wipes, diapers, and car seat. Paalala ko lang po regarding sa car seat, huwag niyo po ilalagay si baby sa front seat. Dapat po nasa sunod na upuan po siya with their own car seat and seatbelt. Tapos naka-face po sila sa rear view or sa likod ng sasakyan. Next is accommodations. So for accommodations for maternity, this varies per hospital. So for prenatal care, so before delivering the baby po, nagpe-prenatal history po muna kami. We also assess the vaginal discharge and such, which I will discuss later on. Dietary consultation, maternity ward accommodation, use of labor room, delivery room, operating room, and recovery room. So magkakasama na po yan lahat sa loob ng delivery room, which I will discuss later. And postpartum follow-ups. Sa newborn naman po, this varies pa rin po. Some government hospitals may not have this and some private hospitals may have this. Nursery accommodation. So, some hospitals po, especially po yung private hospitals, pero not much po sa government hospital, yung nursery accommodation. For neonatal kit, it consists of the sterile blade, cord clamp, clean plastic sheet, surgical gloves, and hand soap. So, kasama din po yung eye prophylaxis and vitamin K administration. So, ito po ay nilalagay sa mata ng baby to avoid infections and tinuturukan din po ng vitamin K for blood coagulation, which will be later explained by student nurse Chrystan. Meron din po newborn screening test. So, dito po sa newborn screening test, meron pong early detection, diagnosis, and initiation of treatment, along with appropriate long-term care, which helps to ensure normal growth and development of the newborn. Tinuturukan din po ng BCG vaccination, which is a prophylactic vaccine against tuberculosis. And along with this is hepatitis B immunization and postnatal follow-ups. So next naman po is the delivery room setup. So as you can see sa picture po, yan po yung buong delivery room. So in the delivery room, we have the sterile and unsterile area. The sterile area is the white part and bawal po pumasok ang mga relatives or kahit sino to avoid carrying bacteria and infections na galing po sa labas. Yung unsterile area naman po, yung pink part, dito lang po pwede pumasok yung mga relatives. Sa Pilipinas po, hindi namin ina-allow na kasama ni mother ang asawa niya or any relatives inside the DR kasi po it is considered to be a sterile area. And para po maiwasan ang anumang infections, hindi po nagpapasok ng tao sa loob except sa mga sterile persons or yung mga persons na mag-a-assist po ng delivery. So, sa unsterile po, we have the anteroom. Ito po yung patient entrance. Dito po pinapalitan ng mga nurses ang pregnant women into their hospital gowns. So, jewelries and dentures are usually removed here. And next, for the dressing area, dito naman po nagpapalit ng mga healthcare workers into their scrub suits. And next, for the receiving area, dito na po yung mga patient's family and physician may stay if they have a need place for a brief conference or consultation. So, dito na po nagsistay ang relatives during delivery. For the sterile part naman po, we have first is the labor room. So, the pregnant clients in the labor room stay here when they are about to expel the baby from the uterine vaginal canal. So, dito po nag-iintay ang mother bago po manganak. Hindi po pwede manganak ang patient sa loob ng labor room. Dito lang po nagmamonitor ang nurses ng progress of labor. Next po is the delivery room. So this is the room where the pregnant client gives birth. Makikita rin po rito ang DR table and medical supplies, and the patient will be positioned in a lithotomy position wherein the legs are flexed and nakalagay po sa stirrups, yung bakal po sa legs. Papakita ko po mamaya. And next is the operating room. So when labor fails or need po na surgery, katabi lang po ng DR ang OR or yung operating room. Dito naman po nagpe-perform ng cesarean section or surgery. Next naman po is the septic area. Dito po naka-area yung mga patients na kinakailangan i-isolate. For example, kung meron man po nakakahawang disease yung patient, dito po muna sila, which is also sterile. The recovery room, yes, the DR also had a recovery room where after pumanganak na mother, dito po pinapastay for at least 2 hours with the baby, of course. And nurses station, so it has an easy access to the unsterile area kasi usually nurses po nagbibigay ng necessary information to the relatives or guardians po ng pregnant client. So next is events. Upon arrival, the patient is received by the DR nurse or the midwife. So hinihingi po namin yung complete name, yung date of birth, yung chief complaint, and dinadetermine po namin yung companion nila in the delivery room. Yung companion po in the delivery room, some institutions allow companions inside, but most government institutions only allow the pregnant woman inside the sterile area. So next po is for chief complaints. Yun po yung um, complaint po kung bakit po kayo nagpunta sa hospital. So kung pregnant woman po kayo, pwede niyo po maranasan ng chief complaints na hypogastric pain, bloody vaginal discharge, and watery vaginal discharge. Yung hypogastric pain po is a sign po of true labor, which was discussed earlier. And it is the active phase of the first stage of labor. Dito po, yung pain po, nagsisimula po siya sa taas po ng abdomen, papunta po sa entire abdomen and lower back or vice versa. May naman din po tayong tinatawag na bloody vaginal discharge. So ito po ay due to the expulsion of mucus plug or yung pressure po sa pelvic area as the baby descends to the vaginal opening. Next naman po is the watery vaginal discharge. Ito po yung tinatawag na rupture ng amniotic sac or bag of water. Ito po yung kadalasan sinasabi na may water broke and hindi po ito nakokontrol katulad ng pag-ihi. Before labor, upon admission, pinagpapalit na po kayo ng patient's gown. Kung ano oras po kayo na-admit at kung ano po yung reason for admission ninyo, yung record po ito. Ang sabi ko nga po kanina, sa labor room, hindi po pwede mga ang patient. So dito po na isasagawa ang history taking, health teachings, monitoring vital signs, monitoring progress of labor, and allowed to have oral fluids and light snacks. So sa history taking, sa ibang facilities po, ginagawa na po ito sa receiving area pa lang to know the history of pregnancy po ni mother. Sa health teachings, we give health teachings and instructions for the mother before po siya mag-labor. We also assess the vital signs such as the BP, pulse rate, respiratory rate, and temperature po ninyo kung nasa normal range po ito. And through this, we assess for signs of complications that may arise. We also monitor for the progress of labor through internal exam according to uterine contractions and fetal heart monitoring. So you are allowed po to have oral fluids and light snacks. Patients are allowed to have oral fluids and light snacks only, but other patients are only advised of an IV fluid and NPO or nothing per orem. Ibig sabihin po, wala po silang kakainin if only indicated by a doctor. So kung cesarean naman po, bawal po kayong kumain 6 hours before the operation. So during labor, hinahayaan po namin kayong pumili po ng posisyon na gusto nyo. Kung ano po yung pinaka-comfortable po si mother, yun po ang susunod. So we have many positions which I will show on the next slide. And during labor po, continuous po yung pag-monitor po namin ng labor po ninyo. At sabi ko nga po kanina, i-admit lang po kayo if kayo ay nasa active stage na inyong labor or kapag nakadilate na po ang cervix nyo ng at least 4 centimeters. So next po we have is the positions. Yan po ang tinatawag po natin na dorsal recumbent. So naka-separate po yung legs nyo, naka-flex po yung knees, and yan po yung usually na ginagamit po position kapag po nag-internal exam. Next po is we have the lithotomy position. Ito po yung position kapag manganganak na po, kung saan pinapatong po yung binti sa stirrups or yung bakal po na nakikita niyo sa picture. Next po is Trendelenburg and Macrobert's maneuver. Ito po, kita niyo po yung knees po malapit po sa chest. So ginagawa po ito to maximize the opening of the vagina. We also have left lateral recumbent. This aids the woman as this releases pressure from the inferior vena cava to facilitate circulation. And meron din po tayong squatting. Yes, may squatting po. And during labor, this is the transitional stage. During this stage po, malakas na po yung contractions in anticipation of your baby, which was discussed on the last topic. So dito po, tingnan po natin yung safety of the mother and the baby. So dito po, hindi na po sila allowed mag-ambulate. Hindi na po sila pwede maglakad kasi po in labor na sila. Ibig sabihin, nag-rupture na po yung bag of water and this will now stimulate the descent of the baby. So, pwede lang po mag-ambulate if nasa latent stage. So, in-encourage din po ang patient to lie in bed. So, usually this time masakit na po yung contractions and this is already at the peak of its intensity and they should only lie in the DR bed or DR table. And they are not allowed to go to the bathroom. Kasi po, especially po if nag-rupture na po yung bag of water kasi this is a sign na po na lalabas na po si baby. So, dapat po nakahiga na lang po si mother. In assessment for signs of impending delivery of the baby, need din po namin i-check yung cervical dilatation po ninyo kung lalabas na po si baby and kung meron man pong complications para po masolusyonan po agad. In the delivery room during the expulsion stage, so appropriate management of prolonged labor, hypertension, abnormal presentation, and bleeding. So the healthcare workers knows the management of these kinds of circumstances. So sa active management of the second stage of labor, naka-upright position po, and we provide a quiet environment for the patient to concentrate on bearing down while in an upright position. And then, meron din po tayong selective episiotomy. So, sasabihin ko lang po sa inyo ito. Episiotomy po is a surgical cut made during delivery in the perineum to enlarge the opening and make way for the baby to come out. So, dito po mag-a-assist po kami as the doctor does a surgical cut. So, sinabi ko lang po ito sa inyo na if ever may complications or hindi po makalabas si baby, then this selective episiotomy will prevent the rupture of tissues in your perineal area. Meron din po tayong active management of the third stage of labor. Yun po yung administration of uterotonic within 1 minute of delivery of the baby. So dito po pinaperform yung unang yakap or EINC, which will be discussed later by my other groupmate. So meron din po tayong uterotonics po like oxytocin, which enhances uterine contractions and prevents postpartum hemorrhage. Meron din po methergine, which is given after placental delivery to prevent bleeding. And next po is placenta delivery. So we use a controlled cord traction with counter traction to deliver the placenta. We make sure to pull the cord gently in a rotating movement to prevent uterine invasion and to deliver the placenta completely. So next po, provision of postpartum nursing care. So we change the hospital gown. So after recovery, we will change your hospital gowns to your comfortable loose clothes to give way to breastfeeding. So we also check for vital signs. Yung unang 4 po na oras after birth is the most critical period for the mother. So we will continue to assess your vital signs and make sure you are below 37.9 degrees Celsius. Because up to this point naman po, it is still considered normal for a postpartum mother. So this time din po, we perform nursing interventions that would prevent the patient from infection and hemorrhage. For rooming in and health teachings, lastly po, after everything, you will have a chance to room in with your baby. If your baby has no other complications, pero kung meron man po, maaari po silang ilipat sa intensive care unit or ICU for further evaluation. Pero kung wala naman pong complications, we suggest that rooming in of the baby with the mother will help develop a special bond and to prevent infections. We remind the importance of breastfeeding and ambulation kasi po early ambulation means recovery, and we will also educate them about newborn care. We also remind the importance of breastfeeding and ambulation kasi po early ambulation means early recovery, and we will educate them all about newborn care. And for the last topic, which is EINC or Essential Intrapartum Newborn Care, will be discussed by student nurse Chrystan. Thank you po.
Ako po si Chrystan at ngayon po ako po ang magtuturo sa inyo at magdi-discuss po sa inyo kung ano po ang EINC, ang kahalagahan po ng EINC at kung ano po ang dapat yung makita pag kayo po ay nagde-deliver na sa delivery room. So unang-una po, ano ang EINC? Ang EINC po, ang ibig sabihin po nito ay ang Essential Intrapartum and Newborn Care. So, under po nitong sa EINC po ay ito po ang mga protocol o ang mga ginagawa po ng nurse every time may manganganak. Dahil ito po ay nagfo-focus po sa first few hours of life ni baby. And may 3 pong guidelines and categories po na under dito. Ang unang-una po ay ang time-bound intervention. Ang pangalawa ay ang non-time-bound intervention. At ang pangatlo naman po ay ang unnecessary procedure. So, i-discuss ko po sa inyo, isa-isa po ito, upang pong maituro sa inyo ang kahalagahan at kung bakit po ito ginagawa. So, unang-una po, ano ang time-bound intervention? Ito po ang mga routines na ginagawa ng mga nurse during the first few minutes po ng pagkapanganak ni baby. Unang-una po, ang ginagawa nila ay ang immediate drying o ang pagpapatuyo agad kay baby. Pangalawa naman po ay ini-initiate agad ng nurse ang skin-to-skin contact. Pagkatapos po nito ay ika-clamp na po nila ang cord ni baby after 1 to 3 minutes. Ang pangatlo naman po ay ang non-separation of the baby kay mother para po ma-initiate nila agad ang breastfeeding. So, the second one po is the non-time-bound intervention. Ito po ay ginagawa lamang ng nurse pagkatapos na pong ma-fully breastfed si baby. So, ang unang-una pong ginagawa dito ay ang immunization, ang eye care, ang vitamin K na pag-inject kay baby, at ang pagkuha ng weight ni baby. Bakit mahalaga ang vitamin K? Dahil dito ay kulang pa si baby ng vitamin K at ang pagtuturok nito kay baby ay makakatulong upang hindi magdugo or mag-bleed si baby. Pang-apat, dapat din po ay hindi po natin agad paliguan si baby within the 6 hours po. So, ito po ang last na ano po ay ang unnecessary procedure. Ito po ay hindi na po ginagawa ng mga nurse. Dahil ito po ay maraming madudulot na bad side effect po kay baby. So, hindi na po tayo nag-routine suctioning, hindi na rin po natin hinihiwalay si mommy kay baby. At ang pangatlo po ay hindi na rin po tayo nag-administer ng mga glucose water. And fourth, hindi na rin po tayo nagbibigay ng mga water formula. And lastly, hindi na rin po natin ginagamit ang footprinting. So, bakit ba mahalaga ang EINC? Mahalaga to dahil ito po ay napaka-effective po na intervention na pwede pong na makatulong kay mother at kay baby upang mas maalagaan po sila ng mga nurse. Dahil ito po ay mga evidence-based po ang intervention na to. Ito po ay marami na pong trials and error na ginawa ng mga researcher po upang ma-develop po at malaman po kung ano ang mas effective na mga pag-handle sa mga baby at kay mother. So, ang EINC po, ito po ay ginagawa step by step. And ito po ay ino-organize into a time-bound manner po. Which meaning po, ito po ay may mga within pagkapanganak ni baby ay may time limit lang po na dapat po magawa na po agad upang maiwasan po ang komplikasyon. So, may 4 po na 4 steps na mahalaga po sa EINC. Unang-una po ang immediate and thorough drying of the newborn. So, pagkapanganak agad kay baby, si nurse ay ida-dry agad si baby for 30 to 1 minute. Ito ay para ma-warm natin si baby at ma-stimulate natin agad ang breathing ni baby. Pangalawa, ang early skin-to-skin contact between kay mommy and kay baby. Ang kahalagahan ng early skin-to-skin contact ay para rin ma-develop natin ang bonding between the mother and the newborn. At also, hindi po dapat, katulad nga po nasabi ko, dapat po hindi po natin pinapaliguan agad si baby within the 6 hours para po hindi po magka-hypothermia si baby o magka-infection at hindi rin po siya magka-hypoglycemia. So, thirdly po, ang proper cording at clamping and cutting po ng cord ni baby. Ang mga nurse po ay gagawin po to, hihintayin po muna nila mag-stop na mag-palpate o magtibok-tibok po ang umbilical cord ni baby or pagtuloy-tuloy pa rin po between 1 minute to 3 minutes po para masigurado po natin walang anemiang mangyayari at to protect na rin po the baby from hemorrhage po. And madalas po ang hemorrhage nangyayari sa mga premature po na baby. At lastly po, ang pinakamahalagang step naman po ay ang non-separation of newborn po para po ma-initiate po agad ni nurse ang breastfeeding kay baby. At ang kahalagahan din po ng breastfeeding ay para po maiwasan po ang pagkamatay agad ni baby dahil sa mga infection. Dahil ang gatas po na galing sa breast milk ni mommy ay meron po itong colostrum. Ang colostrum po ay marami pong mahahalagang nutrients na makakatulong po sa paglaki ni baby at also paglaban po ng mga bacteria na pwedeng magdulot ng sakit kay baby. So ano po ang dapat natin i-expect sa delivery room sa mga nurse? So ito po ay within the first 3 minutes of birth or ang time bound natin. So malalaman nyo agad, ang nurse pag panganak kay baby ay i-call out nila ang time at ang gender ng baby natin. After naman nun ay pupunasan nila si baby, idadry nila for at least 30 seconds para naman ma-stimulate ang baby natin para huminga. Ang pangatlo naman ay hindi dapat pinupunasan ng nurse ang vernix gaseosa or ito ang parang medyo cheesy na tingnan kay baby pagkapanganak. Kasi ang mga cheesy na substance na ito ay pwedeng magdulot ng protection kay baby at tutulong sa kanya na hindi magka-infection. At ang pang-apat naman ay hindi talaga dapat natin papaliguan si baby after 6 hours. Kasi ito ay pwedeng magdulot ng hypothermia at infection kay baby. So ang panglima naman ay asahan din natin i-initiate agad ni nurse ang skin-to-skin kay baby at ang kay mother. Dahil ito ay magde-develop din ng bonding between the mother and the baby. So mahalaga talaga to, ilalagay ng nurse si baby sa tiyan ni mommy o kaya naman sa chest ni mother. So pang-apat naman ay after na punasan ni mother si baby, ay ilalagyan ni nurse si baby ng bonnet at ng lint ng mga kumot upang maiwasan natin malamigan si baby at para naman ma-provide ng init to sa katawan ng baby. So lastly naman, asahan natin gugupitin ng nurse ang umbilical cord ni baby once na nag-stop na to. Or pag di naman nag-stop, within 1 to 3 minutes, pwede na tong i-cut ni mommy, ay ni nurse, para naman ma-prevent ang anemia at ang hemorrhage. So, after the first 3 minutes naman, i-expect natin ang non-time bound. Ito ang mga gagawin ng nurse. So, mag-i-inject si nurse ng oxytocin kay mother sa arm niya. Ito ay para ma-prevent natin ang pagdudugo kay mother. Dahil ang oxytocin ay tutulong sa mga nanay natin upang hindi sila magdugo after nila ipanganak si baby. At ang pangalawa naman gagawin ng nurse ay i-deliver na nila ang placenta from the mother. So, i-check na rin ng nurse kung gaano kalala ang pagdugo ni mother upang magawan agad ng paraan ni nurse kung paano ito magagawa ng solusyon. Ang pangatlo naman ay tuturuan ni nurse ang ating mga mother na bagong panganak kung paano sila magpuposisyon kay baby at kung paano i-attach si baby sa kanilang breast upang alam nila kung paano ma-initiate ang breastfeeding kay baby at ang tamang paraan. So pang-apat ay ilalagyan ng nurse ang mga ating baby ng eye care o ang mga ointment sa mata nila upang maiwasan ang infection. Dahil alam naman natin, maraming bacteria ang nasa puwerta ni mommy na maaaring mapunta sa mata ni baby sa panganak niya. Kaya naman ito ay mahalaga. At ang vaccine din ay isang napakahalagang parte upang maalagaan natin si baby at hindi siya magkasakit. So lastly naman, i-assess naman natin ng nurse if pwede ba siyang i-room in kay mother. Kasi merong mga cases na ang baby ay napakalubha at hindi pwedeng isama kay mommy dahil ito ay kailangan obserbahan ng mga nurse. Kaya naman, mahalagang part sa nurse ang i-assess if okay si baby para naman if okay na, pwede na siyang i-room in kay mother at wala nang problema. So, sana po ay marami po kayong nalaman sa aming discussion ngayon at sana po marami po kayong natutunan at maraming salamat po sa inyo.